Assalamualaikum. Today I'm going to do a review about a paper entitled Use of a Movement System Impairment, Diagnosis for a Physical Therapy and the Management of a Patient with Shoulder Pain. Before we go into the details, what is or how movement system impairment is tested, is being tested to the patient, we have to understand why this movement impairment happen. So basically it's happened because they have a minor alteration in precision movement which lead to micro trauma, and if it's continue use, it lead to macro trauma and pain, and that is where the compensation movement happen. So the compensation movement is called as movement impairment, and it further divided into three types, which is first is changes in muscle length, muscle stiff, and also reducing or changes in muscle strength. Okay, so this case study discuss about the shoulder pain, and when we want to use movement impairment as our task, so we have to understand what is the normal movement first, so that we can compare with the movement that the patient producing, so that we know what is the problem of the patient and how we're going to treat based on the finding of the movement as well. Alright, if we look to the paper at the table 3 about the positive finding from standardized examination. Right, first, before we do the movement to the patient, we have to look the structure in a resting position. So look, if you can see from the side view, humeral head relative to acromion, the finding of the patient is the greater than 1/3 right humeral head anterior to acromion. So it's supposed to be the normal one is no more than 1/3, but in the patient is greater than 1/3. So from this point, we know that's already it's the shoulder is already in a bit anterior. Okay, a bit anterior, and usually it will be medially rotated. So from this point, from this impression, from this finding, we know we can make an impression the shoulder in medial rotation. So how we're going to confirm is by doing the flexion movement. So if you can see in the flexion, they have humeral medially rotated greater than left, so you can confirm that is the problem. The similar is in line, okay, in a movement and also in a resting position, so it's already in line. Alright, so from this point, from this finding, we can make an impression they have a shortness of pec minor. So when I have shortness of pec minor, they have a lengthen of serratus anterior. So we can confirm this by looking at the scapula. And so if you can see, the scapula is supposed to, scapula should upward rotated by 60 degrees, that's a normal, but the patient unable to produce up to 60, the patient able to produce at 45 degree only. That is shows that insufficient of serratus anterior to perform this movement. Alright, so when they have insufficient of, when they have a weakness of serratus, so usually the force couple action of the muscle is actually rhomboid. Okay, the rhomboid is shortness over there. Alright, the shortness of the rhomboid, and we can see because our impression is rhomboid is shortened, so it's actually in line with our finding from the posterior view that scapula is adducted bilaterally, ADD, adducted bilaterally, so it shows that the rhomboid is actually shortened. So how we're going to confirm either our observation is true or not by doing the test of the muscle length and also muscle strength. So from this, we can see that serratus anterior is weak, and the symptoms are also produced, and also the tightness, they have a shorten of the muscle of pec minor over there. Alright, and then if you want to see where the problems happen, either it's actually in GH of scapula, so we have to recorrect the pattern. So the task, what they do is manually assist the scapula upward rotation. That is where the symptom is decreased. But when the scapula is reduced over there, right, the pain is reduced, but how are we going to know it's actually from scapula and also humerus? So we have to do the test at the humeral joint as well. Okay, what did they do? If you can see the next table, the continued table, okay, they have an excessive of medial rotation. So if they recorrect the medial rotated humerus, the pain is not reduced. Okay, so we know that the problem is not coming from the GH, but it's actually from the scapula. All right. Okay, so the other task to confirm the problem is like muscle strength test for middle trapezius, lower trapezius, and also rhomboid. As you can see, the rhomboid is 5/5 strength. Okay, which is, I said, is actually a dominant muscle to compensate the serratus anterior weakness actually over there. So middle trapezius and lower trapezius weak, which is in line with serratus anterior weakness as well. Alright, so from this observation and test that the patient the tester did to the patient, so we can see the problem to the patient. So that is how we're going to rule out the suitable treatment to the patient. So in this movement impairment system, what they do first is to recorrect the movement. Alright, the most important thing to the patient is to know what is the problem of the movement. So the patient need to know what is the wrong movement and what is the right movement, so that the patient should avoid what is the wrong movement and should do the right movement. Alright, either in the resting position or in doing the movement as well. So by doing that, so that is actually for education of the patient, and after that, then give the movement, then give the suitable exercises to the patient that relative which one is the that relative to the finding. So if the patient find that serratus anterior is weak, so we have to strengthen the serratus anterior. If they have dominance and tightness, they have the shorten of the few muscles, so we have to lengthen of that muscle, but it's actually but have to look which one is suitable actually. So that is what the that's what they do, and the finding shows the pain is reduced. The pain is reduced by doing that kind of treatment, and also the pain is reduced, and it shows that this kind of approach is able to use in this type of case. Alright, I think that is all from me. Thank you very much.